Hi there, this is Aisha Lakshmi from All Value Add Trading Channel. Uh, Today I would like to iterate a very important topic, and the intention here is while I was undergoing this treatment, I was also searching YouTube channel and other resources to see how I can feel better, especially during chemo, because I was feeling weak and tired, extremely tired actually, because of every dosage that was given to me and that's how we have this video today. So as you guys would have seen in other videos, I was diagnosed with triple negative cancer, which has only certain clinical procedures such as uh, surgery and radiation and chemotherapy. We do not have any medications, especially for triple negative cancer. Yeah. So uh, now, chemo itself might be given in different categories or different dosages. What I mean is definitely based on the patient, the stage, their different situational or combinational details, right? So, what they analyze and then allocate whatever dosage. I think there are several chemo drugs available in the market, and what comes to us depends on our state and our type of cancer and so on. So, what was given to me, there were two categories of chemo drugs that were given to me. One based on the dosages timeline, I'm saying. So, there was one dosage which was given every 21 days for 7 to 8 doses, and the other was on a weekly basis, so every week a dosage. So these are two different drugs or different type of categories of drugs that were given. Now, when we take up this first 21 days category, it's like one day these drugs are induced into our my means the patient body. So um, it's like a day care kind. We get admitted into the hospital on the day one, and then it takes 6 to 8 hours to slowly induce that chemo drugs. So 3 to 5 bottles of that drugs are induced in form of the saline kind. It is connected to our veins, and that's how it is slowly induced into our body. Because it is very high dose, it cannot be just sent within half an hour or something. That's why it is done very as a very gradual procedure. Since it is a very strong drug, it is not that easy to sustain. Immediately there are some changes that happen in our body. We don't feel comfortable, and you can feel that taste, that sensation, as if something very sour is has entered into your body and so on. So that's how I felt immediately. And sometimes I used to feel very nervous kind or not very good condition during that time. And this happens during that day, 6 to 8 hours. And I used to feel hungry a lot. And even if I eat, the energy drops. I think eating good food is an essential factor for to sustain that horrible medicine, guys. So don't think about your diet or anything during those days. When you feel hungry, eat properly, and that is the only way to address that difficult medications and so on. And you can definitely sustain that way, I can guarantee. Post that day, you will have a gap, means in this 21 days cycle I'm saying. So we will have a gap of 3 weeks. So first week it will be definitely very horrible because that drug will be still in our body for 2 to 3 days. And you won't feel like getting up from the bed, and throughout the day we sleep, and almost 7 days are like that. Everything my family was giving me at the bed and so on. After seventh day, the next 2 weeks is the time where we can try recovering. It means you can slowly walk around and so on. And the other factor that helped me is the lot of juices that I drank. I should thank my husband for that. He gave me a lot of juices during that period. such as when I say juice, it's not fruit juice, it is vegetable juice, the beetroot and carrot. Beetroot is like your best friend because the blood cells, the white blood cells are affected due to chemo, and this is like a very good solution. And this is one main factor that I could sustain chemo is because of that beetroot juice that is with carrot. He used to make me drink 2 to 3 glasses in one stretch, and it was really my best friend during those days because that juice helped me a lot to gain that uh, energy. And I was able to walk around, and at second mid of the second week and all, I used to feel little normal, and third week I was feeling little more better, and then again comes the another cycle and so on. So at least 1.5 week we are moving, and that way when you move only, the tiredness would reduce. If we sleep all the time, the tiredness would increase. So this is a very important factor to try moving and having a lot of fluids. This will help you guys to overcome. And in a weekly dosage, because you have very less time, and of course the dosage may not be that much, the lesser dose. So within 1 or 2 days you recover, and then you have 2 3 days to recover in the same way. So I was following the same strategy for different dosages, and drinking a lot of juices, and trying to move. Of course, you cannot climb stairs and so on, but that's okay. Go slow and follow your body. And by slightly moving, we are doing good to our own body. And uh, I hope these tips will help you. And if you have any queries or any questions that you have, please feel free to ask me. I am not a professional expert in this, but from the patient perspective, I will try to help you what all I know. And I hope you will do well very soon. Thank you.